As we've been reporting, the Biden administration is pushing coronavirus vaccinations to get the country out of the pandemic. The CDC predicts cases and deaths will continue to drop over the next 4 weeks, but the president warns that trend could reverse in the fall in areas with few vaccinations. So far, 41% of the population is fully vaccinated, and nearly 51% has received at least one shot. Despite the slowing pace, life is also returning to normal here in the U.S. As Mola Lenghi reports, many employers are now being asked to bring their employees back to work.
Essential workers never left. The service industry has slowly returned, and now, with more than 40% of Americans fully vaccinated, it's the office employees' turn to go back.
Our office is open, and we expect a mandatory return after Labor Day.
Neil Blumenthal is co-CEO of eyeglass retailer Warby Parker, which employs about 3,000 people nationwide. He says the pandemic has forced companies to be flexible, like providing more opportunities to work from home.
I think what COVID did was enable executives to look back and say, hey, do all these policies really make sense? Is it going to ensure productivity? Is it going to ensure engagement?
A new survey of business leaders obtained exclusively by CBS News finds 27% of their workforce will work remotely, 38% will work at a physical location, and 29% will go hybrid, alternating between both. While some may expect a new, reimagined workplace when they return, it may be more familiar than you think.
What about the COVID-specific changes that people will see in the workplace?
Employees are ready to get rid of the mask. People will respect distance a little bit more. We are absolutely not going to be as underneath each other as fellow human beings as we were pre-pandemic. Other than that, and the flexibility that we've come to see and come to expect, I think things are going to be a lot like they were pre-pandemic.
But a new question companies are wrestling with is whether to require employees to be vaccinated. The U.S. Equal Employment Commission says employers have the legal right to do so, but employees can claim medical or religious exemptions, potentially creating new tension in the workplace after a stressful year zooming from home. Well, companies that require their employees to get vaccinated could expose themselves to potential lawsuits, like the one filed by 117 employees against Houston Methodist Hospital. The hospital insists, Lana, it's simply trying to protect its patients.
Yeah, very interesting, Mola. Thank you. Infectious disease physician Dr. Hlatshwayo Davis joins me now. It's great to see you again. Let's talk about these new ambitious goals, because U.S. coronavirus vaccinations are slowing. But given how much the pace has slowed, do you think that we're going to reach President Biden's July 4th goal of 70% of adults receiving at least one dose?
I will always keep hope alive. I believe that this slow is an expected slow. We absolutely knew that we would capture the most eager people in the population who wanted vaccines right at the beginning of this push, and that at this point we would be dealing with folks who still were unsure, maybe on the fence, and those who are resistant. And so his plan in this push is absolutely appropriate. I appreciate the thoughtfulness around considering barriers to folks being vaccinated. Not for everyone, it's not a vaccine confidence issue. I believe that is part of it. And for that, we continue to have trusted messengers providing trusted resources. But for some, access is key. And I continue to see this particularly in Black and brown communities who continue to be the lowest vaccinated despite increasing in leaps and bounds in their vaccine confidence. And so this innovation around helping with transportation, helping with childcare and incentives is exactly what should be happening. I'd also like to see more mobile units going to folks' homes, because it's not always just about transport. Some people physically have difficulty being away from their home because of care, because of their own morbidities. And here in St. Louis, I sit on the Board of Health, where our Commissioner of Health has done a phenomenal job of innovation and partnering with our transportation services and fire department to get vaccines to people's homes directly. This is exactly what we need for this final push.
Well, as you know, vaccine rates vary across the country, and the head of the CDC is worried that the virus could, quote, rear its ugly head in parts of the U.S. with low vaccination rates. How great a threat is this?
This is a great threat. I think some folks thought that there would be a magic date, that once we reached a certain number, we would be in the clear. But this is a very large country that's comprised of different jurisdictions, and case positivity rates and vaccination rates are not equal across the country. So for that reason, we have to make sure that we get this into people's arms as equitably as possible and make sure that there's standardizations across our geographic regions. Otherwise, as immunity wears down and as we move further away from this first shot, remembering we don't know how long immunity will last. So far, we have data to suggest that it will last at least a year. But once we move along, we will definitely be at risk for surges and going right back to the place that I know all of us don't want to go back to.
Yeah, and as you and I have discussed previously, how we fight the pandemic isn't exclusive just to our national borders, because many countries around the world are suffering. In fact, Argentina, Malaysia, South Africa, they've all reimposed lockdowns. The New York Times actually says that Paraguay and Uruguay have the highest fatality rates per person anywhere in the world, as well as experts warning that India's death toll might actually be higher than reported. Why do you believe there is such a stark contrast in pandemic recovery globally, and how do we bridge that gap?
Well, a few things come into play here. Certainly the variants have made this really difficult for countries, especially middle and low income countries around the world, to get on top of this virus. The South African strain, specifically the B.1.351 variant, has shown itself to be extraordinarily transmissible, but also has shown the capacity to evade immune tactics, making it really difficult to get on top of. A lot of research around the country, even within South Africa and Johannesburg, has been looking at this. And unfortunately, it does not seem to be as easily protected by existing vaccines. This makes it very difficult. If you add to that the fact that vaccine equity has not been achieved, where we see in many places in the world, some people may not even have access to a vaccine as early as 2022. This makes this an absolutely untenable situation. It is paramount that the United States and other countries who have resources, who are able to take the lead here, must do so. A threat anywhere is a threat to us all. And so we need to see not only funding, but sustainable resources being made available to all regions, especially the most impacted right now, South America, India, and places in Africa, to make sure they can make their own vaccines and do so sustainably. We also know that our supply much outweighs our demand right here as we continue to vaccinate folks. So we must be prepared to make donations to this country so that we can all get to where we need to be around the globe.
Before we let you go, I want to tap into your knowledge as an infectious disease physician, because China's National Health Commission is tracking the first known human case of a strain of the bird flu. What more do you know about this, and how concerned are you, and how concerned should we be?
The fact that we're even talking about this and it's just one case goes to show, quite frankly, how much our efforts around COVID have helped us with influenza. The numbers not nearly where we've seen them. This case that is being reported in Jiangsu, China, in the Jiangsu province in China, is in one case, a 41-year-old gentleman. And in that case, we are seeing that the man had this illness for about 2 weeks, but was actually able to be discharged from the hospital and is otherwise doing well. We obviously take these cases very seriously. Avian viruses are not commonly, avian flu viruses do not commonly transfer through humans, but when they mix with human virus, that is when it can pose a threat. So that is why we keep an eye on it. But however, this is exceedingly rare, just one case, but the WHO and everyone else being very mindful, because again, in middle and low income countries, there is absolutely no capacity to deal with the threat of an influenza outbreak whilst we are still trying to combat this pandemic.
So appreciate you putting that into perspective for us and for giving us a little bit of hope that that perhaps we are learning something from this experience. Dr. Mati Hlatshwayo Davis, thank you for joining me and thank you for all that you do.
Wonderful to be back with you. See you soon.